Look at acquired immunodeficiency syndrome, or AIDS, and AIDS is caused by a virus. The virus is the human immunodeficiency virus, or HIV, and it tends to attack our immune system. It is spread through bodily fluids, so blood, semen, vaginal secretions, and breast milk. And it's one of the reasons, one of the many disease processes of why we tell you you always need to do bloodborne precautions. We do standard precautions and standard bloodborne pathogens precautions on every patient, which means we wash our hands, we wear gloves when we're going to be doing care where we might come in contact with bodily fluids. We remove our gloves and wash our hands afterwards. If we think things can be splashed up on the body, we can wear a gown. If we think things can get splashed up in our face, we can wear a face shield, or goggles and a mask. So, but you don't need to be in full gear or infection control or isolation precautions for every time you just go in and talk to a person. You're not going to get it transmitted that way. It's going to be from unprotected anal, vaginal, or oral sex with an infected person. So, and when I say unprotected sex, I'm saying without a new latex or polyurethane condom. The other way we can get it is needle and syringe sharing among IV drug users, or HIV-infected mothers before or during childbirth can pass it through to their babies. And they have found that HIV-infected mothers can pass it through breastfeeding. You're not going to get it from kissing, touching hands, sitting on a toilet seat after someone else had it. It's not going to be transmitted that way. And so if you're using your standard precautions, which is just basic bloodborne precautions for every patient like you should be, you'll be fine. When we know someone has HIV though, or AIDS, we do, like I said, if we think we're going to be doing something where something might get splashed up on us, we would wear a gown, or we can wear a shield to protect our face if something could get splashed on us. Sorry, this thing isn't moving forward. So when we look at the HIV virus, it's the virus that leads to AIDS. So the HIV virus, again, using safer sex methods, they have found can reduce the transmission of infection, and not sharing needles in any way, which is one of the reasons why there are many public places that actually give needles out to drug users. People are like, why are you doing that? You're just encouraging them. Well, they're going to do it anyway. So let's make it a little bit safer for them so there's less disease processes that we have to take care of because of it down the road. So with AIDS, the virus is very fragile. It does not live outside of the body, so you have to have warm body-to-body contact. So it's not spread by casual, everyday contact. It's not transmitted by food preparation. It's not transmitted by, just casual touching. So some people that are infected with HIV have no symptoms at all. Some will have symptoms within a few months. So there have been many people that have been completely symptom-free for 10, 15 years now. Now they can still carry the virus and it can still spread to others even though they're not having any symptoms. So the person with AIDS can actually develop other healthcare problems because it starts damaging the immune system, and your immune system is what's helping your body fight off other disease processes. So the person with AIDS is at risk for pneumonia, for tuberculosis, for Kaposi's sarcoma, which is a type of cancer which has been found with AIDS patients, nervous system damage. But there are a lot of new medications now that can help slow the spread of HIV in the body and reduce complications and prolong a person's life. It used to be if you had a diagnosis of AIDS, you just had a death sentence, and people would just cash out all of their stocks and sell their home and just go live high on the hog and go try to check off as much on their bucket list as they can because they would only live in a year or two. But that's not the case anymore. People are living normal, healthy lives, long, healthy lives. And so we have to, so with these medications now, people can, live these nice, long, healthy lives, and they have to plan for that. So we're going to be caring for people with AIDS or people that are HIV carriers. So again, following our standard precautions, our bloodborne pathogen standards, we should be doing that for every patient anyway. Okay, that's going to protect us. You aren't going to get it because that person bled and it was on the table and now you came along the next day or later and you put your hand on it. You're not going to get it from that. It has to have that warm body-to-body transfer. And then as far as skin disorders, I just really wanted to talk about shingles. Shingles is caused by herpes zoster, and it is the same virus that tends to cause chickenpox. So what happens is the virus, when a person has chickenpox, that herpes zoster, lies dormant or inactive in the nerve tissues. And years later, it can come back, it can start becoming active again. And usually it's during times of high stress that the person's going through that this virus can start reactivating itself and come back. And so generally we see it happen in people over 50 years of age. People who've had chickenpox in the past, they're over 50 years of age, and now if they have any type of weakened immune system, that herpes zoster can actually start attacking the nerve cells and become virulent again. So it causes these nasty, nasty rashes. It looks like a massive chickenpox rash, but it's usually just on one side of the body as a general rule. And there are antiviral drugs that we can use for people, so when they do think that they have shingles, they need to go into the doctor right away and get treated for it, because the antivirals can really cut off a lot of days off of the course of the process. And then also, it's very, very painful. I mean, it attacks the nerves and the nerve endings, and so drugs for pain relief are usually needed as well. Now, we do have a vaccine that's available to prevent shingles, and so they do recommend that once you're 50 years of age that you get the shingles vaccine. This is a really common place that we see it. We see it wrap around one side of the body, and it looks like big clusters of chickenpox. And it is contagious. These people were going to need isolation for this, because this is going to spread just like chickenpox would spread. Okay, so generally we tend to see it wrap around one side of the body right here, and this is called the flank area. Or the other place we tend to see it a lot is like around the eye, especially just it'll affect one side of the eye and one side of the face. People will break out with it really bad there as well. It can happen in other areas, but this flank area and the around the one eye, around the face is more common what you're going to see. And that's going to end this chapter.